Treating children with orthopedic issues is really different from treating adults. First of all, the children are not really separate from their parents in many ways. Children can't tell you often what is going on. You have to rely upon their parents and other people to really help you figure out what's going wrong in the first place. Children also can't make their own decisions, so parents have to end up making those decisions for them. One of the wonderful things about children, but also one of the challenging things, is that children are growing quite rapidly and changing a lot. That prevents us from doing some treatments that you can provide in adults, but it also allows us sometimes to harness the power of that growth to improve the children over time. It's really important to try to work through families with the various decisions that they have to make. Most of our treatments for children with orthopedic issues are not life-threatening, and because of that, there's multiple options that families have to go through, whether it's therapy, medicines, bracing, or surgery, and even there's various surgeries that can be done. And the decisions for those, because it's all very elective, you have to work through those decisions because everything involves its risks versus its benefits, and families need to really understand those, and sometimes it's really hard to do. Families are also very concerned about their children, oftentimes much more concerned about their children than they are about themselves, and so there's a lot of anxiety as they're trying to make the proper decisions for their children. I think the University of Rochester Medical Center Pediatric Orthopaedics Division has been recognized as one of the strong departments or divisions in the country because we can really offer the full package here, both within pediatric orthopedics and throughout the rest of the Department of Orthopedics and the entire Golisano Childrens Hospital. It's really a team effort. When children come here, there is really no service that we cannot provide, and provide it quite well. We have a wonderful pediatric intensive care unit which can help us manage the children after surgery. The pediatric hospitalists have been very involved in the children. We have the developmental pediatricians, the neurologists, the pulmonologists, all of the pediatric surgical specialties, including pediatric surgery, ENT, cardiothoracic. Really, we have the whole gamut on things that can be offered for children. And besides the pediatric orthopedists, we have a very, very strong department of orthopedics, which has superb sports medicine, spine surgery, foot and ankle surgery, where we can get the input of a lot of really, really good professionals in taking care of children.
We first took the girls to see Dr. Sanders in May of 2008. Josie was 2.5 years old and Juliana was 1.5 years old. The first time we stood in his office and he took the x-rays of both the girls, and we came back and he explained they have multiple epiphyseal dysplasia. I can honestly tell you he must have said that word 20 times, and you, as a parent, you kind of go into shock, like, okay, something's wrong with my child. You have no idea how large or small it's going to impact, but you think to yourself, okay, something is wrong with my child. And both myself and my husband kept having like short-term memory loss. I was like, could you tell me what that word is again? And no matter how many times I asked him to repeat it, he sat there pleasantly, never got nasty, never just, yep, I'll tell you again. And he made us feel like we could have sat there for another hour and asked questions. The other thing he did was he took the time to say, after we had asked all of our initial questions, and he looked at us and he said, I am sure you have a million more questions that you've yet to think about. What I'd like to do is I'd like to send you home. I'd like to give you a couple websites and encourage you to go out and do some research about everything that I've given you. Then what I'd like to do is set up an appointment and have you come back and ask me all those questions that you're going to think of after you walk out this door. The girls, both girls, I think, Juliana and Josie, are both going to benefit from the treatment they've received at the University of Rochester on multiple levels. My husband and I both grew up in a small town in upstate New York. So to have a medical facility like this, we would not have access to it. We would have to travel probably at least 2 hours in either direction. And honestly, I'm not even sure if there's an orthopedics division up there within the United States that could handle this type of disorder. My husband can tell you back to his day when he was treated as a child for the same disease, how when he used to go to the hospital, and then granted this is back in the 1970s, it was a ward and it was a white room full of beds that everybody stayed in. My husband has very few memories of it, but when he comes to orthopedics here, especially pediatrics, it is so child-oriented. Everyone is on their level. They make it fun and interactive for them. Even to come here to the hospital and see the children's floor, he says he could not imagine. At one point, my husband was in the hospital for 6 months at one time, and he says he could not have imagined being in such a fun and interactive place where people related to you on your level.